Hello friends, I am Dr. Osvaldolemus, aesthetic and anti-aging doctor, and as you can see in the title of today's video, I'm going to explain to you why NCTF is a great option to improve the eye contour, especially to make it natural, hydrated, nourished, and beautiful. So if you want to know how to improve your eye contour naturally and safely, stay for this video as I explain how. Before starting this video, I remind you to subscribe to my channel, click on the notification bell and like this video. This way you help me a lot to keep growing so I can create more content and help people to have safe and informed aesthetic medicine. By the way, if you are a health professional and you would be more interested in learning how to do this kind of procedures in a proper way with step-by-step protocols as a class, I leave here a link so you can access them. We recently went to Paris to Muchas, which is the most important plastic surgery, dermatology and aesthetic medicine event in the world. It occurred to me to make a video of what treatments the French are using the most. And one of the things that caught my attention is that they use a lot the application of NCTF 135 in the eye contour. And I said there are so many options, why precisely this product? You have to take into account that the laboratory is French, so it is very easy for the doctors there to handle it. It is a treatment that we do a lot in the office, but I wanted to dive a little deeper into the subject, and since I really liked it, I came to share it with you. You know, I rarely talk about specific brands on this channel, and this is not a paid collaboration or anything like that from Filorga. I'm simply showing you what I like and how we use it here. NCTF has become an exceptional choice for eye contour revitalization in my practice and is part of my protocol where I combine technologies like Liftera and Photon. But regardless of whether or not you have access to this type of technology, the pure injection of a revitalizer of this quality goes a long way in nourishing the eye contour. Keep in mind that the eye contour is one of the most sensitive and thinnest areas of the skin and is a very punished area by time and neglect. Yes, our carelessness. Having erratic vascularization, it stains. Having erratic lymphatic drainage, it puddles. Because it is a very thin area, rubbing it hurts it, thins it, and stains it. Makeup affects it. Allergies also affect this area, and even in the skincare routines we skip them because we apply everything like this. Sometimes we put a little bit on the eye contour, but very few people apply skincare on the upper eyelid and well on the eye contour because it is close to the eye. We even talk about sunscreen. Many people do not apply sunscreen on the eye contour because they only half apply it here and omit this area. So this area is very prone to dehydration and malnutrition, and this is where a cocktail of high purity hyaluronic acid with vitamins and minerals comes in, which will also nourish the skin. There are many poly-revitalizers in the market. It is not the only one, and I could even say that it is not the cheapest, but in my opinion, when it comes to injecting in the supraorbital area is the most worthwhile. As it is a pure hyaluronic acid with a very soft rheology, it can be applied to the upper eyelid and obviously to its surroundings and lower contour without generating small balls or residues. In addition to hyaluronic acid, it contains 12 vitamins, 23 amino acids, 6 minerals, 6 nucleic acids, and 6 coenzymes. So it improves hydration, elasticity, luminosity, and firmness. It is a preventive treatment, that is to say, patients from the age of 18, if they need it, it can be applied, and from the age of 25, it can be used as a corrective treatment. Why do I like the NCTF specifically? Because injecting the eye contour is not something that is so comfortable. It is not painful, but nobody likes to have a needle close to the eye. So if we are going to take advantage of the puncture, we have to take good advantage of it, and we have to give a quality result. And besides the result being of quality, it has to be long lasting. As I already mentioned, what we expect to see in general is a brighter, more beautiful, more nourished, more moisturized eye contour. It has some side or adverse effects because normally there may be bruises from the sting, erythema. Even in some patients it may swell a little bit because of the stings, but we are talking about the first hours. It is very rare as such. I have never seen an inflammation, but it is written but in general applied in a proper way. That is to say, in the superficial layer of the skin, you should not have any complications and the results are tangible and very beautiful. How many sessions are necessary? This will depend on the age of the patient and the quality of the eye contour. Very young patients, as a preventive measure, can have 2 to 3 sessions with an interval of 15 days. Older patients can have 4 to 6 sessions, the same with 15-day intervals, and the improvement is gradual depending on the number of sessions you do and the time you let the treatment mature. Obviously, after a week, you will see a beautiful effect, but the real effect will be seen as the weeks go by and the tissue regenerates and nourishes. The perfect complement to this treatment is the Fotona Smooth Ice. The combination really makes a perfect match and greatly improves the eye contour, giving a soft, beautiful, and natural look. Wow, why should I use NCTF 135 on my eye contour? And before I start this video, I want to say that this is not advertising and no one is paying me for this. I just want to share it with you. First of all, what is NCTF? NCTF is an injectable product from the Filorga brand that is used to poly-revitalize the face, but specifically in the eye contour area, it gives very nice results. I'm not going to lie to you. When I took it to Mexico, I did say, aha, it's expensive. Expensive, but because I hadn't seen all that it could do, and the truth is, my respects. Basically, it is a skin nutrition booster. It is to hydrate and nourish the area, and although we have many options for the face, in the eye contour area, I had not found a hyaluronic acid that you could inject even in the upper eyelid that does not generate volume, that does not pigment, and that does not run the risk of pulling water and causing edema. NCTF is a hyaluronic acid that is a glucose aminoglycan that is in the dermis and helps a lot in the uptake and retention of water to improve skin hydration. The truth is that what I said was just to look fresh, but it is the truth. This part of hyaluronic acid contains 12 vitamins, 23 amino acids, 6 minerals, 6 nucleic acids, and 6 coenzymes. In other words, it provides hydration, firmness, and radiance. It's a great product. And this, obviously, depending on the patient, if we combine it with a smooth eyes protocol, the eye looks incredibly beautiful. This can be used for both prevention and correction. Remember that now the wave of prevention is coming. All of you who are watching me are already very interested in the world of aesthetic medicine. Remember to always prevent to keep us natural and then not have to correct or overcorrect. If you are interested in more topics about the eye contour, we have a section dedicated to this in the channel that has more than 10 videos about it with specific and punctual topics. If you are a health professional and want to learn the protocols and apply this type of treatment or others, I leave a link below to see what classes are available. If you like this type of content, you already know that you help me a lot by liking, sharing, subscribing to my channel, and clicking on the notification bell so you'll be the first to see my videos. As always, I remind you there is a comment box down here for you to ask me suggestions or questions, and without further ado, as always, see you in the next video. Bye.